Today we are going to talk about the regional classification of bones, which is the second most important type of classification. Which means we are going to classify bones depending upon the site in the body where they are located. According to this, we classify bones generally into two categories. Number one is the axial skeleton, which is present along the axis of the body, and the other one is the appendicular skeleton, which is connected to the appendages or the limbs of the body. So this is basically the limbs, and this involves the bones of the trunk. Axial classification is important, and the entire regional classification is important, and you need to remember that in an adult there are approximately 206 bones. We are going to study them in detail. The total bone in axial skeleton are numbered 80. We have the skull. Skull has three further categories. The cranium, which is the vault of the skull in which our brain lies, and the facial bones, which make up the facial structures like the eyes and the forehead and like the cheek and the chin, etc. They will number out to be 22. There is a hyoid bone in the neck, which is a very small bone. It is a singular bone. Then there are three ear ossicles or three bones in each of the middle ear. Because there are three in each, so 3 into 2 makes total of 6 bones. If you add these together, they number out to be 22 plus 1 is 23, and plus 6, these number out to be 30. Now the second part of the axial skeleton include the vertebral column. In the vertebral column, although there are 33 vertebrae in total, but the sacral vertebrae fuse to form one vertebrae, so the count is gonna be 26. There are 6 cervical vertebrae, 7 cervical vertebrae, and 7 cervical are found in the region of the neck. Then there are 12 thoracic vertebrae. Then there are 5 lumbar vertebrae. Then there are 5 sacral vertebrae, but they fuse to form one single in adult. And the coccygeal vertebrae are also 4 in number, but they also fuse to form one. So 5, if we add all of these together, what do we get? Here I have done the math that if we count the 5 sacral fused ones as a single one and 5 coccygeal fused ones as a single one, we get total of 26 bones in the vertebral column. But if we count them apart, that is, we add the 24 bones stated above and add 5 of sacral to it, 4 of coccygeal to it, that makes a total of 9. We have 33 unfused bones. When they are unfused, in a child we get 33, but in an adult we have 26 bones in the vertebral column. Then we have got ribs, which are attached to the vertebral column and they form the thoracic cage. There are 12 on each side, so we have 12 into 2, 24. And then we have got one sternum, which is the main bone in the center which covers the heart. This is 1. Now if you add 30 and 26, what do you get? You add 30 and 26, you will get 56. 56 plus 24, what do you get? 56 plus 24, you get 79. And then 1 of sternum, you get an 80 of the total bones in the axial skeleton. Let's move on to the appendicular skeleton, which means the bones which are present in our limbs. The upper limbs being our arms, the shoulder, the hands, and the lower limbs being our legs, thighs, feet, etc. Now the bones in the upper limb are 30 on each side, so we have 60. And that within the shoulder girdle, which is the bones that form the shoulder joint, they are 4 because it includes the scapula and the clavicle, etc. So it's scapula and clavicle on each side. So we get 2 into 2, 4. Then bones of the lower limb, they are also 60. 30 into 2, we get 60. And bones of the hip girdle, is just one bone, which is the pelvic bone on each side. So it is 2. If you add these figures, what do we get? 120 plus 2 plus 4, 126. Now the total bones in the body include 126 plus that of the axial skeleton, 80. So we have 206 bones in an adult. This figure you need to remember, as it is going to come up very often later on, and it is often asked later even after you become a doctor in various viva questions, etc.